morning, and thank you for tuning in today. My name is Janet Calderwood, and you are watching The Dietitian on a Mission, because I am on a mission, and I'm on a mission to help you live better, healthier, and give you the most up-to-date, practical nutrition and health advice that I know about, and that means bringing to you experts in different areas that can help present that information to you as well. It is truly a privilege to have one of the best, most professional physical therapists that I know in the house with me today. And I guess I really should call you Dr. Matt Laporte, right? Because you are a doctor of physical therapy.
Correct. I am a doctor of physical therapy.
So
yes.
I should call you Dr. Matt. That's got a nice ringtone to it, Matt. But actually, Matt, he is one of the most humble but helpful and effective physical therapists that I know, and it is truly a joy to watch him with the patients, because you can see that he really meets the patients where they are, and I think that's so important, and that's why he's here today, because he's going to meet the viewers where they are, and he's going to help us today understand more about really exercise and what the health benefits are and how we can all get on board to get moving more. So thank you again for being a part of the Dietitian on a Mission. I want to congratulate you on the birth of your new daughter.
Thank you very much.
To you and Erin. That's your wife's
yes,
name? Okay.
Correct.
So Erin, if you're watching, congratulations. I know you have your hands full as a mom, but from what I understand, Matt's very involved as well, and so he's a great dad. So we're glad to have you here, Matt.
Thank you.
Exercise. Now, some people just hate that word,
Sure.
don't they?
Some people hate that word, totally. And some people have a lot of experiences with exercise, negative with exercise, right? And I think a lot of people, too, get a little overwhelmed when they hear that term exercise. They may go to the doctor, and the doctor says, you need to exercise more. And I think, where do I even begin? Like, what does that mean, exercise? And I want your viewers to understand that when we say exercise, what we mean is movement. We want to move more, right? So if we haven't moved, if we sat on the couch and led a very sedentary lifestyle, that's what we do today, right? We sit on the couch.
Eat bonbons.
We go eat bonbons. We walk to the car, we sit in the car, we drive to the grocery store.
Yeah.
We grab the grocery cart, we lean on the grocery cart, straining our back.
Go through drive-thrus.
Right, we go to the bottom shelf to pick up a gallon of juice, and we bend at the waist, straining our back even more.
Oh, gosh.
So we don't move.
And
we don't move enough.
people, they do all their shopping online,
right?
They don't even have to, everything's a click of the finger,
right?
I mean, years ago, think about, you know, I guess, you know, people actually had push mowers, then they had self-propelled lawnmowers, now they have riding mowers, and all of those changes have really contributed to the sedentary lifestyle
and
that
you
we
brought
have.
up, and you brought up a great point where people dislike exercise, a lot of people, right? What I always tell people is, or they may say, I don't have time. That's another common one I hear. I don't have time to exercise. What I always tell people, whether it's I hate exercise or whether I don't have time, is you can either make the time now or make it a priority now, or you'll be forced down the road to make it a priority because you'll have sickness, illness, aches and pains, not feeling good. So it's really a choice. Either make the time now and make it a priority now, or you will be forced down the road to make it a priority.
Well, you know, it's funny because when you ask people about what is truly a priority in their life, I always tell people, well, it's things that you make time for every day. For example, bathing, brushing your teeth, things like this, we have time to do that. Well, exercise can be, you know, it's just something like you fit into your routine. If you do something like that on a daily basis, I don't really like when people say, oh, do it 3 to 5 times a week or whatever, but if it's part of your daily routine, and we're going to talk about all the different types and what that can look like for somebody of various levels and lifestyles. So Matt's going to help us find a way that you can actually move more in your daily routine. But I mean, if it's a part of what you do every day, it becomes a priority and a habit.
And it has to be a priority. If we're doing it in terms of, if I have time this week, I'll get in an exercise, it's not going to happen. It has to be a priority. It has to be put on the calendar just as much as an important meeting, an important lunch date with someone. It has to be a priority every single day that this is my exercise time, and no, I'm busy during these hours because I'm exercising. So it really has to be that priority.
So, and there's so many benefits to exercise,
Sure.
right? Not just the fact that maybe you can pull out that dress that you haven't worn in 20 years, but I mean, let's talk about some of the physical, all of the benefits
Sure.
that comes with exercise.
And it goes back to what you said about people that say, I hate exercise. Well, exercise helps with things like sleeping better.
Okay.
Exercise helps with stress levels, with anxiety, with worry. It helps with general well-being. It helps with aches and pains in our body. So we're talking about, when we go to the doctor and he says exercise more, I don't think that's enough driving factor for a lot of people. It's not enough motivating factor for a lot of people. I think people need to determine what's their reason why they want to exercise.
Okay.
Right? So whether it's, I want to be able to pick up the grandkids when they come over.
Sure.
I want to be able to get on the ground with the grandkids to play with the grandkids. I like to do woodworking, and I'm having trouble picking up boards and things to do woodworking.
Or I want to lose weight.
I want to lose weight. I want to get back on the golf course. There's going to be some strong reason why people want to exercise.
Okay. And then, so with exercise, we know there's different types and everything, but what are some of the benefits? You said sleeping better, and then you listed a lot of the physical aspects of benefits with exercise, that they want to have some motivation for the reason to exercise, but like reducing pain and all that, those are some of the good physical reasons. But how about emotional well-being and things like that? You did say stress, but I mean, people will feel better about themselves.
Sure. So we've seen that studies show that exercise releases endorphins, kind of that feel-good hormones in the body. So we actually feel good. A lot of people that exercise get what's called a runner's high because these feel-good hormones are released throughout the body. So we actually feel better. And why do we see people who are they hate to miss a workout, right? I mean, they just need to exercise. Even if they're on vacation, they need to get their exercise in. Why is that they need to get that exercise in? Whereas some other people can't stand exercise. It's because we get these feel-good hormones. We actually feel better physically and emotionally and mentally when we do exercise.
And when we think about, people are already discouraged and they need to feel better. They need to feel better, and I think that when, even as they begin something like that, is a healthy lifestyle habit such as exercise, that it can have that positive cascading effect, right? They exercise, they feel better, they're like, oh, I feel better, I'm sleeping better, I'm going to do more of it, and it just continues and continues and continues.
Exactly, and I think a lot of people, what happens is they lead a very sedentary lifestyle. So maybe they haven't done anything for 10 years, and then they jump into some crazy workout.
Like they're going to run 10 miles a day and do a half marathon.
Too much, too much.
Yeah.
Right? There's this big explosion now of CrossFit, which is very popular with a lot of people. People going from which I think is great. Anything that promotes health and fitness and movement, I think is great.
Okay.
But I think people who are very sedentary, sitting on the couch, going to do these Olympic lifts that athletes train years and years to perfect, too much.
Yeah,
right?
I mean, they're going to risk their possible injury and
stuff. We
need
to kind of gradually increase our movement, our exercise. So if you've never exercised in the past 10 years, a 5-minute walk around the neighborhood is perfect.
Okay.
We're in competition with ourselves, so we know where we're starting from. It's gradual increase of that movement and that activity.
So when doctors, sometimes people say, oh, check with your doctor before you begin any exercise program. And then I heard one doctor say, the best exercise that anybody could do is the one that they will actually do.
Right.
And so, I mean, and does exercise mean that somebody actually has to go to a gym to perform any given amount of movement?
Absolutely not. And it kind of brings me back to what we talked about when we term exercise, we mean movement. So we need to move more. So what you would find fun for exercise, I may not find fun for exercise. Riding a stationary bike at my house is not fun to me. But actually going to the gym, that's what I enjoy. Other people like to walk around their neighborhood. Some people like to play tennis, get out and play golf. Some people like to go dancing.
What about hula hoops? They're a great way.
If I could do it, maybe I would, but
I can do it for about 30 minutes straight, and the world record holder did it for like 3 days straight.
That's
it was
impressive.
a guy, he did it. But finding I think fun is the key here.
Because fun is going to make us want to do it more.
And it's not gonna have a derogatory connotation.
Right.
Oh gosh.
And studies also have shown that adding music to a workout has improved performance during workouts. Absolutely.
It's funny that you bring that up, because I don't watch a lot of TV except unless I'm on. I'm just kidding. But when I go to the gym, I do enjoy walking on the treadmill and watching the news and different things. And I was listening to this really slow music while I was, the closed caption with the TV, and then I switched it from cardio, 80s music, and my pace from the treadmill went from 2.5 to 3.4.
Absolutely.
And I didn't even feel it. I was just really walking more consistently with the beat of the music.
And that's in direct correlation with the studies that show that music does, in fact, increase our performance during a workout. So yes, I encourage most people to use music. You'll find people, it gives them distraction, but also increases their workout.
Intensity,
right, the intensity of the workout. I also caution people, though, on distractions during workouts. You see people that will bring a book or something to a gym, or ride a stationary bike reading a book. They can get so distracted in something like a book where they don't focus enough on the exercise that they start to slow down. So just caution there with distracting yourself during a workout, but music is
music
excellent.
is good. And you mentioned, so we're talking about fun activities, and we know there's different forms of exercise. Can you tell us, we've got pro athletes, right, that do it for a living, like football players and baseball players and people like that, swimmers and so forth. And then we have the novice, the very beginner. Can you maybe describe some of the different types of exercise and how they can really impact the different individual, what they're looking for?
Sure. So we have cardiovascular training, which helps us increase our cardiovascular system, our heart and our lungs. So things like walking, running, riding, walking on a treadmill, things like
Maybe
that.
riding your bicycle.
Riding our bicycle, walking around the neighborhood to improve.
So it's where you're really getting your heart rate
Exactly, raising our heart rate.
Okay.
The other type would be strength training, using weights. And I think a lot of people shy away from that. A lot of people, when they think of exercise, they go right to a cardiovascular type of workout, which is important. But I don't want people to neglect that strength training portion. As we get older, we lose muscle mass.
Yes.
So it's really important that people continue to do that strength training component to their workout.
Okay.
It's simple things, picking up the grandkids, improving our balance, all that is related to our strength training, which is really important.
Do you feel that, so strength training, you talk a little bit about the cardiovascular workout. So one's good for the heart, one's good for the muscles, but they're both equally important, right? And neither one should be neglected.
Exactly. It's got to be that balance between too much of either one. I think they're both very important. I always encourage people, if they're going to do both in the same workout, to really do the strength training portion first.
Okay.
So you have the strength, the stamina to be able to provide some resistance to your workout.
Okay.
And then the cardiovascular portion second. I find that people switch that and they do the cardiovascular first, they're too fatigued to do any type of weight training after.
I had that problem before myself, actually.
You see people go into a gym and they'll hop right on the treadmill first, then go to the weight room, and they're just too fatigued to provide any resistance. So
I'm going to switch things around.
I would switch it up.
Okay, switch it up. What about, so there's also something called high impact, low impact, or medium impact, and then no impact. Now, can you explain why those different classifications of exercise exist, and who would be a good person for each of those categories?
Sure. So we see a lot of different types of exercise, and we also see, so running is a very high impact on the joints type of exercise. We see a lot of deterioration of the knee joints, especially with any type of running activity. So things like walking on the treadmill, riding a stationary bike, or riding a bike around the neighborhood is going to be it's going to be much better for the joints in terms of joint health. In terms of the intensity of the workout, people always want to know how many reps am I supposed to do for a certain strength training exercise. We're looking for anywhere from 10 to 12 reps of each exercise for functional movement in our environment, for getting around our environment, picking up our grandkids, picking up groceries. Anywhere from 10 to 12 reps is a perfect amount for your viewers to be doing.
How many sets would they?
Anywhere from 3 to 4 sets is perfect. Before we start any strength training, we want to do just a gentle warm-up, whether it's a walk on the treadmill, walk around the neighborhood, just to kind of get the blood flowing.
And how long should that last?
5-10 minutes is perfect.
Okay.
And we'll start to feel our breathing increasing a little bit. We'll feel that blood flow flowing throughout the body. We just want to warm up the muscles before we start that strength training component.
Okay, and then, so you're talking about maybe 3 to 4 sets of 10 to 12 reps.
Correct.
What about these people, I mean, you see them at the gym, they're just like doing the heaviest thing they can do, like 1 or 2 reps. Is that effective at all?
It depends on your goals, right? So if we're bodybuilders, yes, but our goal is really to function better in our environment. So to go and do bicep curls, how often do we do that in our environment? We don't, right? We have multiplanar activities. We incorporate different muscles. When we stand up from a chair, Jan, that's over 200 muscles we're activating.
Really?
Yes.
Oh, wow.
So to go to the gym and do this, why? Why are we doing that? We need to do more multiplanar exercises, more functional exercises.
Okay, that we can be using a lot more muscles and things like that.
Exactly.
Okay. All right, now what about, we know that of course we need air to do these exercises, because if you're not breathing you can't perform, right? Well, do you have any strategies like do people breathe through their nose or the mouth through their nose, and slow breaths, or what's most important,
so,
like when they're lifting weights and things like that?
Right, and particularly with strength training, people tend to hold their breath because they're trying to force the weight, and so you see them holding their breath, which is really the worst thing. It's going to increase our blood pressure. We're really at risk with our cardiovascular system when we do that holding of our breath for strength training. So at the toughest part of the exercise, we want to be blowing out through our mouth.
Okay.
Okay? And then as we're letting that weight down,
out through their mouth.
Out through the mouth. As we're letting that weight down, in through the nose.
In through the nose. Okay. All right. And
I always tell people a funny thing, when they talk about breathing, how to teach them to breathe. In through the nose, out through the mouth. The only time you hold your breath is if you're going to do underwater swimming. So any exercise, if it's underwater swimming, hold your breath. Otherwise, we need to be breathing through the exercise.
Breathing. Okay. Now, we know that there are numerous benefits, like for people that have like osteoarthritis and a lot of debilitating conditions that like Parkinson's disease and things like this. Are there some specific exercises for these types of diseases that would be worth noting today? Like what would you recommend maybe, Matt, for somebody that has osteoarthritis?
Sure. So with osteoarthritis, actually what's interesting is we all have arthritis in some form, because we have the joints, we have the two bones rubbing together, and on the bones is a smooth covering of cartilage.
Okay.
So they glide together nice and easy. As we age, we start to wear away that smooth cartilage. So then we have bone rubbing on bone, which is arthritis.
Okay.
So we all have some form of arthritis. It's a normal part of aging. What happens is the tendons and muscles that cover a joint, if they're tight, they give a lot more pressure to that joint. So we want to make sure we incorporate a good stretching program to our routines to reduce that strain and that stress on that joint.
Okay.
We can also strengthen the muscles around that joint to relieve some pressure on the joint, particularly the knees, the hips, the shoulders.
So stretching is really important for people with osteoarthritis?
It's extremely important. It's extremely important for anyone because we sit so much these days. That's really important that we stretch.
Okay. Well, one time what we're going to do is when you come back, we're going to do a show where we're standing up, because we're going to have the people that are watching the show, like they could be standing up watching us right now, right?
Absolutely.
Like they could stand up and watch TV.
And there's so much we can show them in their house that they can do without any special equipment.
And we are going to have a show like that. It's coming up and you'll have to stay tuned. I'm not going to tell you. It's going to be a surprise when you see it. But he'll be back, and I will be demonstrating the exercise. It's going to be fun. It's going to be like an exercise class, so you don't want to miss that. But so what about, Matt, for people? I know that swimming has some benefit for some people. What type of individual would that be probably most suitable for, that can't do a lot of exercise?
Right,
maybe?
so swimming is excellent because it's buoyancy, right? It supports our body weight. So people that are in chronic pain, people with back pain, people with arthritis, the support of that water really just helps them be able to do things in the water that they can't do on land because of the weight of gravity affecting their pain levels. So I think anyone that's in pain, whether it's back pain, whether it's arthritis pain, would benefit from being in that kind of that water environment is really great for them.
And do you find that people that do, I guess, what would we call it, water therapy or whatever, have a tremendous benefit in some of improvement in managing your pain, or even maybe preserving some of that muscle?
Absolutely, and I think it's mentally too, because they get into the water and they think, oh my goodness, I was never able to do this particular movement, but now I'm able to. It gives them that renewed confidence that they're not going to be like this forever, right?
Okay.
That they can function, they can get better. It gives them that confidence.
Okay, so swimming exercises are certainly
excellent.
good. And then, you know, and like we live in Southwest Florida, so I mean, thinking about the climate and everything, you know, canoeing and kayaking and so many water sports and outdoor activities. I mean, if you're, you know, even if you're fishing without you just standing there, but if you've got a tarpon on the end of that pole, that's going to be a real fight for you.
Sure.
So looking for things that you enjoy and trying to incorporate them, I think would be really, really good. And especially if you have a family, and you know, doing family activities together would be really important to let your entire family understand how important movement is.
Absolutely.
Do you agree?
I totally agree. And I think also it's little things, going to the store and driving around 5 extra minutes to find that spot closest to the front of the building.
Yes.
How about if we just park a little bit further and we do an extra walk to the front, right? So little things.
Exactly. And it's funny because even with, you know, when people wear like a tracker or something like a Fitbit or a pedometer, which actually measures your steps, by actually wearing one of those devices, it is actually shown that people move more, that the amount of activity they do is significantly more than not wearing it. And what's even great is they can see the reward, because we know there's like, what, 2,000 steps in a mile?
Correct. So we're looking for around 10,000 steps in a day.
10,000
5
steps.
miles would be a great goal.
And they don't have to go to the gym to do that. They could
Correct.
walk their dog. They could, like you say, park further from the store. They could, you know, sometimes I always tell people, if something's important to you, not just sticking with plan A, but have a plan B. Especially if it's a rainy season, you know, it's gonna, if you're planning an afternoon walk in Southwest Florida at 3 o'clock and it's the middle of summer, you better be ready for a plan B.
Sure.
And so that could be maybe some indoor mall walking with air conditioning where you're not going to glow or glisten, you know, not a whole lot of sweating there, which is my kind of exercise. I like that. But indoor activity, or even walking the perimeter of a huge warehouse store, as long as you're not stopping at all the little displays eating along the way.
Correct. People that like photography, taking your camera on the walk.
Oh, that's a
You
good
know,
idea.
and back to the pedometer thing, even I know people that use, the whole family has pedometers.
Oh, really?
And at the end of the day, they all compare how many steps did you do. It's a little bit of a challenge. So you're holding each other accountable and kind of challenging each other each day to increase the number of steps.
And you know, Matt, it's really simple. It's like the average person, if they just, they can gain 10 to 15 pounds a year just by eating an extra 150 calories. Well, a 20-minute walk will, for most, be about a mile. Some can walk a little faster. They can burn that extra 150 calories in about 20 minutes. And that right there, just by making that one change, right? We know that they could have a gradual weight loss and just say, well, you know, when you ask people, what did you do to lose that 10 pounds in the last 6 months? Well, I just started walking. You know, I got a dog.
Movement, right?
Movement. I got a dog, and we go for a 20-minute walk, and I didn't, you know, I didn't even notice. It didn't even change anything. Right? So it makes a big difference.
It makes a huge difference. And I think, too, people get to a certain age and they consider themselves, I'm too old, right, to exercise.
Yeah.
right, society tells them that they're too old. I read an article, it was great, it was really interesting a few weeks ago. She was in her 80s doing triathlons, this 80-year-old woman doing triathlons. Now, I'm not saying everyone's going to go out and run a marathon and do triathlons, but we're never too old to move.
We're never too old.
Our body was made to move. So whether we're in our 70s, 80s, 90s, it doesn't matter. We can all move more than we are.
I like what you said about, you know, you're in competition with yourself. Don't look at what your neighbor's doing, whatever.
Right.
But if you start, like one of the things that I have for myself is just push-ups, right? And, you know, and I'm like, my goal is to be able to do a certain amount by the end of the year. So every day, the first thing I do, right when I get out of bed, I go ahead and get them out of the way. And then I feel good, like, wow, you know, I've already accomplished something at the beginning of the day. You know, I just want to say that we have a nice little video. It's a website you can go to. It's Matt's website. It's called startmovingit.com. And you got to check it out. I mean, because he is such an encourager, and you know, it's really important not only for your health, but for your physical health, but for your mental health. I think you'll especially, you know, when anytime there's no wrong time to start exercising.
Correct. And I wanted to show people through that video that they can exercise without any special equipment. And it doesn't have to be complicated. When people hear exercise, they don't know where to start. I want to show them where to start.
And they don't have to hire an expensive trainer and all this. But that's really good. And then what about, can you, like, doing nothing's going to change. People have to make a decision to do something different.
Correct. And it's like I said before, you can either make the time now or you're going to be forced to make the time down the road. When you go to the doctor and you have some illness, sickness, you have aches and pains, you put on a certain prescription medication, and it's never too late to start. Even a chronic illness, it's never too late to start moving more.
And never too late to start. I like that. And I just think that you know, it's important to remind people the importance of hydration, right?
Sure, absolutely. It's so important, especially being here in Southwest Florida, right? We get the heat. It's important to keep a bottle of water with you during your workouts. When we start to get dehydrated, we get things like, we get fatigued. We have...
Especially if you're sweating.
Especially if you're sweating, glistening, whatever you want to call it. Exactly. But it's important to stay hydrated, to have loose-fitting clothes, to have good footwear. All those things are really important for a good exercise program.
They have one really cool fitness store now where you can actually, they will give you a few pairs of shoes to try, and then they take pictures of you on the treadmill to see what shoe wear is the best for you. So they're, you know, because proper footwear is important.
It's so important. I mean, that's your base of support. That affects everything. That affects all the way up the chain. So it's really important.
Thank you, Matt. That's good information. Sorry to cut you off there. Time is up, and thanks for tuning in.